Picture this. You've lost 20 pounds or maybe 50 or maybe even 100. Your clothes fit differently. People notice you. You feel lighter. But instead of peace, you also feel alert. You wake up one morning, step on the scale, and it's up a few pounds. Your stomach tightens, but not because of the pounds, but because of the memory of what it felt like when the weight kept climbing. And that fear, that quiet fear creeps in and it says, what if this is the beginning of regaining weight again? If that sounds familiar, this episode is for you. Hey, I'm Dr. Kisha Pickford, a nurse practitioner and a holistic nutrition weight loss coach. And welcome to Weight Talk Thursdays, where we talk about losing weight after 40 in a way that protects your metabolism, your hormones, and your peace. Today, we're unpacking the real reason the fear of regaining weight lingers, even after progress. I used to weigh right at 400 pounds. So even after losing 130 pounds, there are moments when I feel a flicker of fear. Not a panic, not a meltdown, just a thought. What if I gain my weight back? And what I've learned both personally and clinically is that fear of regaining weight isn't about willpower. It's about physiology and identity. The fear of gaining weight back is incredibly common, especially if you've dieted for years, you've regained weight back before, you've used GLP-1 medications for weight loss, or you're navigating perimenopause or menopause. When you've lived in a larger body, your nervous system stores that experience. And when you lose weight, your brain shifts into protection mode. Because biologically, your body is designed to defend stored energy. And that's not a mindset flaw. That's physiology. And when you've worked hard to lose weight, regaining weight feels like a threat. So your nervous system reacts, not because you're weak, but because your body remembers. And after 40, this fear can feel even stronger, especially with our hormone changes. For instance, estrogen fluctuations impact fat storage, insulin sensitivity, and water retention. And cortisol, our stress hormone, it affects appetite signals, fat storage patterns, and blood sugar regulation. And if you're using GLP-1 medications for weight loss, your appetite regulation has been assisted hormonally too. And when that assistance changes or fluctuates, your brain senses uncertainty. Fear of regaining weight isn't just emotional. It's hormonal and neurological. When fear leads our behavior, we may overrestrict, overexercise, hypermonitor, or obsess over the scale. That stress response increases cortisol, and elevated cortisol can increase water retention and impact fat metabolism. So, ironically, fear-driven control can make your body feel less safe. And safety is what supports long-term weight stability. I had a client recently who had lost 35 pounds. Every Monday, she would text me her weight. In 1 week, it was up 1.8 pounds. She said, I knew it. I messed it up. But when we looked at her week, nothing had changed. What had changed was her stress. She had a big work presentation. She wasn't sleeping well. Her cortisol levels had elevated. Her body was holding water. It wasn't regaining weight. It was her physiology. And here's what I want you to understand. The fear of weight regain is not proof that you will regain weight. It is proof that your brain remembers. If you've ever been significantly overweight like me, your identity has been shaped around that body. Even after 130 pounds off or weight loss, there are moments where I feel that flicker of fear. But the difference now is awareness. Fear is memory, not destiny. And here's a question I have for you. What if the goal isn't eliminating fear, but building metabolic and emotional trust? Trust in your habits, trust in your hormone health, trust in your consistency. Maintenance after 40 is not about perfection. It's about regulated physiology and regulated thinking. So this week, when weight regain fear shows up, don't tighten control. Instead, ask yourself, is this fear or is this data? Did something actually change or did my brain just react? Give your body evidence of safety instead. And this means begin to eat consistently, sleep well, lift weights moderately, reduce stress, because safety supports hormonal balance, and hormonal balance supports sustainable weight. And this is exactly why I focus on hormone-informed holistic weight loss inside my Fresh Start coaching program. Because losing weight is one phase. Learning how to keep it off calmly, metabolically, and confidently is another. And if you're ready today for action and some steps to move from fear to trust, my book, The Wait is Over, guides and walks you through that shift. And you can find both at amplehealthandwellness.com. If this episode is resonating with you, I need or want you to type trust in the comments. Because after 40, the goal isn't control, it's stability. Well, that's all I have for today. Thank you for joining and listening. Until next time, I need you to remember your health is not a secret. It's your story. So own it. Bye.